So thank you, everyone, and welcome to the Care for Caregivers webinar series. We appreciate you taking the time out to be here today. Today's webinar is going to be about psychological health and safety in the workplace and how it plays an integral role in maintaining the psychological health of frontline workers. There's going to be strategies that employers can utilize to improve organizational resilience, learn about tools and resources that are available to help. So just give me one moment and we'll get started. Just a few housekeeping items. So this webinar is being recorded. It will be made available on the Care for Caregivers website after it's completed. If you experience any technical issues or you have any issues with logging in, please feel free to send an email to webinars@safecarebc.ca. Someone would be happy to assist you. So this Care for Caregivers, the initiative is a collaboration between SafeCareBC, the Canadian Mental Health Association BC, with funding from the Ministry of Mental Health and Addictions. And while we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land which we each call home. I want to start by recognizing that we are gathered on the ancestral and unceded territories of the First Nations, Inuit, and Métis people across British Columbia. We thank them for being good caretakers of this land and allowing us to be visitors on the shared territory to do good work. I'm just going to give a brief intro about our facilitator today. We have Amenda Kumar from WorkSafeBC. Amenda has worked in the field of mental health for over 10 years, working for both government and private organizations, joined WorkSafeBC in 2014, and since has worn several hats, including case manager and claims, investigation officer, and currently as an occupational health and safety consultant for mental health injuries. I am just going to quickly mention that on the Care for Caregivers website, you could also access the Care to Speak line as a resource, and as well as the Care to Listen podcast. And I'm just going to turn it over to Amanda, so just give me 1 minute. Hi, thank you, Amanda, for joining us. I will turn it over to you and we can begin.
It's great. Thanks, Kavol, and thanks everyone for joining me today. It's my pleasure to be here. So I am just going to share my screen here. Just give me one quick moment. Like here. Okay, wonderful. And hopefully you can see that okay.
It looks great. Yeah.
Good. Okay, excellent. Good. So as Kavol mentioned, my name is Amenda Kumar, and I'm an occupational health and safety consultant at WorkSafeBC. So in my role, just to make quick mention, as you know, WorkSafeBC is a rather large organization, and we have many different departments, from claims and compensation to assessments. I work in the prevention division, and that is really looking to help employers promote psychological safety in the workplace, as well as providing resources for workers in terms of maintaining their mental health and well-being and resilience. So that's the focus of my presentation today, in terms of providing you some resources, hopefully some new information, but probably also some older information that you may be familiar with and may just act as a bit of a refresher. And we'll also go over some resources that are available to all of you in the important work that you do. I also wanted to make mention that I do come from you, and I acknowledge that I'm working from the traditional and unceded territory of the Coast Salish peoples, including the Squamish, Tsleil-Waututh, and Musqueam First Nations. So my pleasure to be here with you today. Okay, so to get started, I wanted to make a quick mention about also in my role at WorkSafeBC, we work very closely with the BC First Responders Mental Health Committee. And it's a committee that represents about 14 first responder organizations, as you'll see on the table there, with representation from everything from fire, law enforcement, dispatch 911, and paramedicine. And the committee actually first came together back in 2015, basically with the recognition that there was a gap in mental health supports available to first responders. And so a lot of the work that the committee does, and we still meet regularly now, the mission is really ultimately to sort of be a leader in providing mental health tools for leadership, best practices for frontline workers. We create a number of resources, campaigns, training opportunities, really to support first responders, their communities, and their leadership. So I make mention of that because some of the resources that I'm going to share later in the presentation have been created by the BC First Responder Mental Health Committee in the work that we've done in partnership with them. And so that although it's designed for first responders, I would say that there's definitely information that would be relevant and probably quite practical for all of you. So I wanted to make mention of that, and we'll talk a little bit more about that when I get to the resource section. Okay, and so in terms of what we'll cover today, so I'll first start off with some background and statistics just to set a bit of context in terms of mental health in Canada and sort of some background and definitions there. We'll also go over some self-awareness tools, so ways of looking at recognizing some signs and symptoms for if you or someone you know may be struggling with their mental health. We're also going to look at some strategies for building your individual resilience. So what are some things you can do for yourself in terms of taking better care and being mindful of what might help you in building your resilience? And then we'll look at a little piece around stigma and what that means. I'll end off with some resources that I can share that may be supportive in terms of helping with mental health and other things. And then we will have some time for Q&A. So we should have a little bit of an ability to dialogue at the end if you do have any questions. Okay, I should also make mention that if you do have questions that come up during the presentation, feel free to put them in the Q&A. And I certainly can have a look at that at the end of the presentation. I'm also going to offer a couple of questions throughout the presentation. So if you have answers and thoughts around those questions, please also put your answers in the Q&A, and that's where I'll monitor that, okay? Okay, great. So to start off with some background and statistics. So at any given time, 1 in 5 Canadians will experience a mental health issue or illness every year. And this is about equivalent to 6.7 million Canadians that are living with some type of mental illness or challenge. In comparison, 2.2 million Canadians have type 2 diabetes, and 1.4 million Canadians are living with a heart disease or a heart condition. So as you can see, 1 in 5 is actually a pretty big number. And what we know is that mental health sure is, something to be talking about. It's an important topic because a lot of people, especially, around the world, we're knowing that it's becoming more and more of an issue. Also, 41% of Canadians say their mental health has declined since the pandemic. And I think it's fair to say that all of us have been affected in some way, right? So whether it's some, major changes out there socially, or fear about your own health or the health of your family, financial stressors or struggles, even, operating in a different way when it comes to our work in the workplace. If there was shifts there, or, there's all sorts of things that have really impacted our mental health since the pandemic. An estimated 1 in 4 adults will experience major depression at some time in their lives. And depression is the most common mental illness, as well as the most treatable. And I want to make mention of this, that depression is very common, but it doesn't have to stay fixed and permanent. So the other piece that's also very hopeful is that there's treatment available for any condition, really. So depression or anxiety are also very treatable conditions that we can seek support and we can move through. People with a mental illness are twice as likely to have a substance use problem compared to the general population, and at least 20% of people with a mental illness have a co-occurring substance use problem. And I think this is also an important statistic in that it sort of makes sense. Oftentimes we'll look for ways to cope with our stressors and our struggles. And actually, going back to a statistic around the pandemic, alcohol consumption had gone up about 40% at the beginning of the pandemic. And stress can often be easily coped with by substances. So, often people were finding that having a glass of wine or having a drink after work was an easy way to wind down. But once we become sort of dependent on those types of coping strategies, they can cause problems for us in the future. So we also want to be mindful of the way that we're coping with our stressors. And so this statistic here, when it talks about the correlation between having a mental health challenge as well as substance use, sort of makes sense, because oftentimes, if we're using substances to cope and to numb or to escape from our problems, they can often become dependency issues. So something to be aware of, and we'll talk a little bit more about that as well. Now, another piece around mental health, and just to get us all on the same page, what do we mean by mental health? So the definition is, it's the emotional, psychological, and social well-being of an individual. And this affects how we think, act, and feel. It also determines how we handle stress and relate to others, and how we make our choices. So mental health is really about how we're doing individually. And each of us will have sort of a range on how we may be feeling. Now, there's also something called organizational mental health. And this is sort of, the occupational culture that's cultivated in the workplace. And that's, the sort of patterns, the actions, beliefs, traditions held by members of the same organization. So really the culture and how that plays a role on an individual's mental health. So the culture at work can certainly have a positive or negative impact on how we're feeling in our mental health. So although today we're focusing on this webinar on our own mental health and strategies for our own resilience, I should say that both of them go hand in hand in terms of the organization's mental health and sort of what the culture is. So just making note of how those two kind of interplay with each other. What we also know is a term that's being used more and more, you may be hearing, is psychological health and safety, sort of a term that's coming up. And the impact of psychological health in Canada, the economic cost is large. So as I mentioned, the importance and why we're having this conversation today as well is that it really is an issue. So it's estimated that the economic cost is about 51 billion per year in Canada. And this includes healthcare costs, loss of productivity. This is sort of reductions in health-related quality of life. So all of the costs that are related to when we're struggling with a mental health issue or injury. And what we also know is that 47% of workers consider their work to be the most stressful part of their day. So this is also why we want to be thinking about how do we boost our resilience, and how do we also, protect and promote psychological safety in the workplace. We also know that approximately 25% of Canadians are affected by psychological health issues. So as I mentioned, in our previous stat, we know 1 in 5 in Canada, but in the workforce, that's 1 in 4, 25%. So it's likely that, you or someone may be struggling with some type of mental health challenge or issue. And only 23% of workers feel comfortable talking to their employer. And this is another place that we definitely have room for improvement in terms of making the workplace a safer place, as well as promoting psychological safety, even when it comes from a leadership lens. So some other common definitions, again, to get us all on the same page. Stress, something that I'm sure you've heard many times before, but what do we mean by that? And really, stress is any type of change that causes physical, emotional, or psychological strain. And it's our body's response to anything that requires attention or action. So as you know, we're going to have some degree of stress. And it doesn't necessarily mean that all stress is bad. Stress is something that we deal with on a regular basis. And the way that we respond to it is going to make a difference in terms of our overall well-being. So this is also, again, why we want to think about strategies for managing stress, as well as how do we build and boost our resilience. Another term you may be very familiar with is burnout. And this is specific to workplace stress. So it's the chronic workplace stress that hasn't been successfully managed. And this shows up in sort of 3 characteristics or dimensions that we can kind of look out for. So often when people are burnt out, they find that they've got feelings of energy depletion. They're feeling really exhausted, very tired. They also feel they may have sort of a cynicism or a negative energy towards their job and sort of wanting to create distance from that, feeling really frustrated with work. And then there's also a piece around reduced personal efficacy or effectiveness. So sort of recognizing some performance issues and just, maybe some challenges there. So really some specifics when it comes to burnout and some signs around, if you may be struggling with that. So we'll talk again about some strategies around burnout as well. So if we want to really turn our minds to signs and symptoms, and I like to say that in the world of things that are out of our control, one of the best ways for us to focus on the things that are in our control is self-awareness. I think self-awareness really can be a superpower. Because the better we know ourselves, the better we're able to connect with supports and seek out, what we may need if we are struggling. So the mental health continuum model is an excellent tool and resource that I like to use when it comes to boosting self-awareness. And this was first developed by the Mental Health Commission of Canada. And as you can see, the mental health continuum, it sort of goes through the full range of signs and symptoms when it comes to being able to talk about our mental health. So in the past, I've had many people say, it can be really hard to talk about mental health and describe how I might be feeling. And so the model gives us really specific signs and symptoms and tangible ways to acknowledge and be able to identify how we may be feeling, or maybe, what we notice in others. So if we start on the left, you can see the healthy category is signified by healthy green. And in that area, in that box, you can see the signs there are not normal fluctuations in your mood. You're taking things in stride, you're feeling calm, basically being able to manage stress, without a major issue. This is also where you'll find that, sleeping well, there's normal sleep patterns, little difficulty there. You're physically well, physically active, good energy, consistent performance, and likely, doing well at work, physically active, socially active and connected. And there isn't really any issue with alcohol use or substances. Now, as we move down the continuum, and as you can see, when we get to yellow in the reacting stage, or injured in the orange phase there, and as we start to move down, we start to notice different signs and symptoms show up. So this is where nervousness, irritability, there may be more anxiety and sort of sadness showing up, feelings of restlessness. This is also a time where we may have more trouble with sleep. So there may be disruptive sleep, intrusive thoughts, maybe some nightmares coming up. And this can, of course, impact our level of energy. Increased fatigue shows up. We may have sort of more physical manifestations of headaches, pains, body aches, those sorts of things. And we may also then notice that a difficulty of concentration and performing at work shows up as well. This is also in this sort of phase and category where we may actually want to withdraw socially. So oftentimes when we're not feeling well, it's not uncommon to actually want to withdraw and isolate and not talk to people and be sort of on your own and alone. And so sort of an indication that we may be sort of struggling a bit there. And then as we get into the red zone, and as you can see ill, the signs and symptoms here quite clear that we're quite, we're struggling. So excessive anxiety, easily angered, maybe feeling depressed. At this point too, there may be some suicidal thoughts or thoughts of self-harm that could show up. A lot of difficulty with sleep and physical exhaustion. You may also be struggling with some physical illnesses. And this is also where we find that it's really intrusive and difficult when it comes to our ability to perform work and maybe other sorts of duties and responsibilities. So trouble with concentration, This is where we may be more absent at work. And we also have a tendency when we're struggling in this way to isolate or to avoid social events, social, interactions and things like that, as well as an sort of a tendency to cope with substances. So this is, again, where it can be very easy to turn to things that disconnect us to allow us to escape or to reduce our pain, our challenge, our stress, our struggles with using things like alcohol and other substances. So as you can see with the full continuum, really gives us specific signs and symptoms to look out for across the board. And the great thing about this model is that for each category, it also gives you recommendations and suggestions if you find yourself in any of the categories. So as you can see, if we were to turn our minds to the very end on the red zone there, this is where it's important to seek consultation when needed, follow up with a healthcare provider, maybe seeking some support from your GP or any other supports that you may have available to you. Now, I should make mention that this model, it goes from healthy green to ill in the red, and it's very normal to go from a healthy green to injured orange or even in the red zone in a matter of minutes, in an hour, depending on the situation, right? So if we're struggling with something, if we've, been involved in an incident, if something very stressful or maybe even traumatic has taken place, it would be completely human and normal to go from healthy green into, the orange, the yellow, the orange, or the red. But the key here is if we're staying stuck. So if we're staying stuck in the orange or the red zones for a period of 2 weeks or more, where you're noticing those signs and symptoms, this is an indication that we really do want to then seek help and support because we may be struggling. So really to keep in mind that if you're sort of staying there and the mood's not fluctuating, so you're not able to bounce back, this is where we really want to maybe intervene and do something in that way. We actually have a lot of workplaces, and some of the first responder organizations that I work with actually even post this up in the workplace as a way for us to speak the same language. So, at actually even some fire departments, people will use the color coding system. So, oh yeah, it's a green day today, or you know what, I'm in the red zone if something's happened. So we're all sort of speaking the same language and understanding where we may be in our mental health. So a great tool that I like to share. Now, I wanted to open up a question to all of you and just to get some ideas around what are some signs that someone may be struggling with their mental health in the workplace. So maybe if you just wanted to take a minute to think about this, but what are some signs that may show up when you're working and may be an indication that someone may be struggling with their mental health? And if you want to just put your answers in the Q&A, I'll give you a minute to think about that. Excellent. Great. Yeah. So changes in behavior, maybe noticing brain fog or maybe troubles with concentration, changes in personality. Yeah, they may be withdrawn. That's right. Okay. Yeah, great. Maybe irritable or anxious. Yeah, great. They can't focus. There may be some anger, lack of concentration. You're right. Increase of absence, lack of engagement, stress. Excellent. Great answers. Yeah. And very much, in line with some of the things we actually saw in the continuum model. Anger, missing work, maybe socially disengaged. Excellent. Calling in sick. And presenteeism is also another one I'll make mention of in a moment here. Excellent. So good. So really some ways that we may be able to see that someone may be struggling in the workplace. And some of the things, to make mention again is, it's very common for us to have an array of emotions in times of stress or uncertainty. And this is even, particularly back during COVID. we're noticing a lot of people talking about feelings of helplessness, lack of control, feeling overwhelmed, feeling lonely, or hypervigilance around lots of excessive worry and things like that. And the way that it really can show up in the workplace, a lot of what most of you have mentioned here is things like you're noticing reduced productivity or difficulty with concentration, maybe being late or absent to work, and the presenteeism, working too much. So some people actually show up to work, maybe if they're not well, as a way to disconnect and distract and maybe leave their stress behind. So working a lot can even be another one. Working too little or maybe being absent, another indication that someone may be struggling. And social isolation, of course, withdrawal from others, as we mentioned, can be very common. If we're struggling, we don't want to be around people, don't want to see people or talk to them. And increasing agitation, irritability, anger, sadness. So you may find sort of these big, maybe emotional responses or reactions that are showing up as well, and all very normal if someone may be struggling in the workplace. Some of the other things that we notice and impacts of poor psychological safety, or if someone is struggling at work, low engagement. So not being sort of as involved or feeling as motivated as maybe they once did. This is also where we find increased injuries, so near misses or accidents, and this is linked to that, trouble with concentration, or maybe being easily distracted. So as we know, that makes it much easier to have injuries or potential accidents. Self-harm or suicidality, another one. And we talked about sort of absenteeism, presenteeism. This is also where there may be more workplace conflict. So even interpersonally or relationally, there may be challenges. And then overall, at the workplace, this is also where we sometimes see a lot of claims, healthcare costs, lots of turnover, people not sticking around, and maybe some difficulty with retention and hiring, and pieces around decreased, and in your case, I know it wouldn't be customer, it's probably patient satisfaction, but these sorts of things as well. And so what we know, and to go back to the sort of a bit of the model, the continuum model, is that we deal with stress on a regular basis. And so why it's so important and why we're having this conversation today is that if we stay in a state of heightened stress, let's say at work, and even when we go home and in our personal time, it actually increases our chances of not only physical injury, but also psychological and mental health injury. And, as you've probably heard before, when we're stressed, our body goes into a survival response. And in that survival response, our body is activated into a fight, flight, or freeze response, right? So the survival response is automatic, and it's been around as long as humans have. So back in cave people times, before we had language, before we had technology, civilization, our human beings were, wired for survival. And so if you had a bear running at you in the forest, I sure hope you would be, your survival mode would kick in, and you would be in your fight, flight, or freeze response, because that's how we manage stress and that's how we protect ourselves. So we would be wanting to fight that bear, we would wanting to run from that bear, the flight response, or we would freeze and play dead with the bear. And that's in fact what's helped us survive as a species. And that's why humans are still around. But fast forward to now, and if we are in a constant state of stress where our body stays in that survival response, and we're in our fight, flight, freeze, day in and day out, we're there at work, let's say, and maybe at home, all of these things in the body, like that increased heart rate, the sweating, maybe shortness of breath, muscle tension. And this is also where we've got our stress kind of chemicals like adrenaline and cortisol are on a high. Our body doesn't get a chance to rest and recover. And so in that heightened state, and sometimes how we would describe it is hypervigilance or hyperarousal, it really does make it that much more prevalent, or we become at higher risk for psychological injury and for struggling with mental health issues. So this is why it's very, very important for all of you in the important work that you do to be taking good care of yourselves. and really to be thinking about how do I boost my own resilience so that I'm also taking care of myself, right? So before we get into some strategies, I want to first ask you, what is resilience? So you've probably heard the term before, but what does that mean to you? And again, let's look at I'll monitor the Q&A, and I would love to hear your thoughts on what is resilience. Excellent. Great. Yes. So the ability to bounce back, the ability to keep going. Yes. Bouncing back following adversity. Excellent. Great. Yeah. The ability to deal, coping with stressful events. Great. Yeah. That's fantastic. I think all of you have probably heard resilience many times before. You're on the ball. Ability to persist, recover from hard effects. Yeah. Positive self-talk. Great. You're all right. Yeah, that's absolutely correct. So when we talk about resilience, it's the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And then it's also the ability to bounce back from difficult experiences. So resilience actually is twofold in some ways. It's preventative in that we can build our resilience by taking good care of ourselves and being mindful of where we may be in the continuum. So we're sort of getting behind, sort of a point where we may be really struggling or injured, right? So all of the preventative piece in terms of taking good care. And then there's also a piece around, and many of you mentioned this, the ability to bounce back. And this is sort of where we would maybe name it as recovery. So bouncing back from tragedy or stressors or incidents where we have access to the supports and resources that will help us recover. And we'll be talking a little bit about both prevention as well as recovering and the bounce back piece. The other piece I wanted to make mention of is that there's actually three pillars of resilience. When we talk about resilience, there's individual resilience, which is how I take care of myself and the piece around self-awareness and making sure that I'm on top of the things that I need to do to stay healthy and my well-being. There's also family and workplace or organizational resilience. And the webinar I did a couple of weeks ago focused on the last one there, the organizational workplace resilience piece. That's kind of the what leadership and also what the organization does in terms of that culture piece and their mental health. But, again, our focus today is individual resilience. So we're really going to focus on what I can do for myself in taking good care of my mental health. Okay, and so what we also know is that mental health is just as important as physical health, and the two really do go hand in hand. So again, things you may have heard of before, taking good care of our physical health, we have three pillars that probably aren't new to any of you, but good reminders that good sleep, diet, and exercise are the three pillars of physical health. So as you know, if we're not sleeping well, if we're not eating or staying hydrated, and if we haven't had any movement, if we've stayed sort of stagnant, those are three things that really do impact our physical health and how we're feeling. But they sure can impact our mental health as well and our moods and things. What we also know is that social support is the #1 predictor of positive mental health in the workplace. And so social support really being that sense of connection, and we'll talk more about that, but a sense of connection to, maybe it's in your workplace, your colleagues, your peers, your mentors, helps to boost and improve individual resilience. We'll talk about a sense of connection, maybe also with others like family, friends, and other supports as well. And the other piece is around self-awareness and education. So really being aware of where you may be in the continuum, as we sort of talked about, having a good awareness of how you may be feeling, and then also knowing where to get help and what resources are available to you, which we'll talk about as well. So what we know is that employers are supporting mental health more and more. So although we don't have psychological health and safety mandated in legislation, there's no specific policies that make it part of our regulations, a lot of employers are recognizing just how important it is to our workers, to our workforce. And there's a number of supports that are becoming available, I think, across industries, really. So a good place to start may be with the supports that are available to you in your workplace. And connecting with supports really can improve your resilience. So if we take a look at this, I think an important thing to remember here is finding a good fit, and that mental health is not a one-size-fits-all model. So what may resonate to me in support and what works well for me may be very different for you. And so what you are going to want to do is think about the options that are available to you and really sort of thinking about what's going to resonate. So if we were to look at, for example, an employee and family assistance program. So EFAP has mental health clinicians, psychologists, clinical counselors, and so on that you could connect with to seek support. And I should make mention that, again, if we think about prevention, it's always a great idea to potentially connect with a therapist or some mental health support before you have a problem. So, developing some rapport and getting to find someone that's a good fit for you can often be very helpful if you're already doing well, so that, let's say, when the time comes and you are struggling, you know where to go and you know who to seek out for support. So an EFAP, if a program to assist you in that process may be a place to start. I also know that peer support is also available to you in your Care to Speak peer support program. So another excellent resource, and peer support can also be very important in that it allows us to debrief and may be a source of social support that may be helpful. Internal work support. So I know with the Care for Caregivers program on the website, I did check out myself actually, that has a number of excellent resources that are available there. Extended health benefits. So you may have extended health benefits where you're able to pick the clinician of your choice. And that would, if you want to look at your plan, supports available for mental health, again, through whether it's a psychologist or clinical counselor. And so maybe looking into that if that felt like a good fit. Mentorship or community connection. And again, you may have leaders or mentors within your organization, or maybe even the broader community that you could connect with that could potentially be a good support. And another one that sometimes we forget about, but I wanted to make mention of, is spiritual support. So I have, again, some first responder organizations that even have a chaplaincy service within their fire halls, or they've got First Nations elders that they connect with. They've got temple members that are available for spiritual support. Fitness or sports team that may, again, be a way for you to connect with support that may be a good fit. And then WorkSafeBC also has a number of supports that are available. We have our critical incident response program, social work, and prevention support services that I'll be sharing more about in our resource section. So really the idea here is to be thinking about, preventatively, what are the supports that are available to me that may be a good fit and that may be a good support should I be struggling. Now, the other thing to make mention of, and I think, I sort of mentioned it earlier in my stats around the pandemic, with all of the things that are out of our control in this world, it can be very helpful to focus on the things that are within our control. And really starting with the pillars of health, so sleep, diet, and exercise. If we're not sleeping enough, as you know, we're often having impacts on our mood and the way that we're able to show up for ourselves and other people, whether that's our families or even in the workplace. So sleep, such an important piece to make sure we're maintaining, good sleep hygiene there. Of course, nutrition, so making sure that you're eating well and getting nutritious meals, as well as hydration and some movement, so that you're not staying, even if it's just a bit of fresh air or a short walk can really help the body and the mind. Now, the last two pieces around social connection as well as relaxation, again, really those important pieces to help reduce the risk of psychological injury. So as I mentioned, social support really being an important piece, especially when we're struggling. We often want to withdraw and we don't want to be around people. But this is often when we should be seeking support and talking to people that we trust, people that are safe, and really seeking the support there. And then again, ways of connecting with stress management. So whatever that might look like, but ways of making sure that you're getting those breaks to the break in stress so that you're able to rest and recover. And again, reduce your chance of mental health challenges or psychological injury. Okay, so again, some tips around taking care of your mental health. And this was particularly during COVID, what we noticed, one of the key pieces, lots of information that was out there in the news and social media. And what we also sometimes forget is just the way that we're consuming food, we're consuming, water and putting things into our body. We're also consuming information. And information can also have an impact on our mental health and our moods and how we're feeling. So I was working with some people that found every time they would be, watching or listening to a news story of something terrible that was happening or something that was out of their control, it was actually changing how they were feeling. So their mood was impacted. And, a heavy heart can impact, how you carry yourself as well as, your own mental health. So putting some limits on how often and how much you access the news or even social media can be a good tip for making sure that it's not impacting your mental health in negative ways. Also to note that even scrolling or watching, listening before bed can also have an impact on even sometimes restful sleep. So wanting to make sure that you're getting a bit of a break and no screen time, or maybe watching things that are heavy on the heart when you're trying to get that good rest and sort of relaxation. Using healthy coping strategies to avoid falling into problematic patterns. And so, as I mentioned earlier, can be so easy for us to try to escape, numb out, or disconnect by using substances, alcohol, or other things. And so we really want to turn our minds to what are some healthy ways that I can get that rest and relaxation and that disconnect from my daily stressors. So things like, we've already talked about the pillars of health, but stress reduction techniques. So whether it's yoga or mindfulness practices, if that's deep breathing or, meditation, some people find music, whether it's listening to it or playing an instrument, to be very relaxing and helpful with their stress. Other people that like to do art, whether it's, painting or drawing or any other artistic form or something that allows for your creativity. Other hobbies that you might have, whether it's swimming or cycling or reading, anything that really the point here is finding ways to create that disconnect from your stress. And really that then allows us to get our bodies into that restful state where we have less chances of, increasing the risk of mental health injury. And then, of course, paying attention to your moods and how you're feeling. So, recognizing that our moods can fluctuate, and they sure will, depending on what's happening around us. But if we're staying stuck in that, as I mentioned earlier, that orange or the red zone, making sure that we're paying attention to that so that we can seek support when we need it. And then this last piece, of course, on reaching out to social supports, even when it may not necessarily feel like you want to do that, but if you're noticing that you're isolating and withdrawing, a really good time to be reaching out. Okay, so, and I wanted to, make sure that I put a piece around stigma, because I think no presentation about mental health is complete without a note on stigma. And so before we kind of dive into this topic, again, I wanted to hear from all of you, maybe a term you have heard before, and if you have, what are your thoughts? What is stigma? And I'll just have a quick look at the Q&A again. I'll give you a minute. Excellent, thank you. So shame or social shame, yes. Judgment, okay, good, yeah. Perception, yes, excellent. Yes, great. A fixed negative belief. That's right. Good. And I think it sounds like you probably have, many of you maybe heard of this term before as well, in terms of stigma. Good. Yes, believing that others are less than me. Excellent. Injected values. Great. Thank you. Yes, it sounds like definitely, maybe not a new term, but I'm glad to get your feedback and see that, many of you definitely on the right track there. And so when we talk about stigma, what we mean is it's a mark of disgrace associated with a particular circumstance, quality, or person. And stigma can actually show up in a couple of different ways. So actually, many of you made mention of this. Self-stigma is the negative views around mental health. So this is the views I have about myself if I'm struggling. The view that I'm weak, I'm not good enough, I should be stronger. What are people going to think of me? Shame, feeling those feelings of shame that I think many of you mentioned. So really, the thoughts that I might have about myself if I do find myself, struggling with my mental health. Social stigma is another one. And that's the negative stereotypes held by society about mental health issues and the people that have them. So really this fear around how I'm going to be viewed and what other people maybe in the workplace, what are my colleagues going to think of me? What is my boss going to think of me if they knew I was struggling or if I spoke up about it? And so social stigma can also be another one that can be very difficult for all of us in navigating our mental health. And the reason I bring this up, and I find that it's an important conversation to have, is that stigma can really get in the way of us seeking support, as well as being able to promote mental health in the workplace. And the reason is because, for a very long time, when mental health was sort of looked upon and sort of, and we were being judged in that way, it keeps us from being able to seek support and be open and to feel safe in being able to have these discussions. And which is why it's more and more important for us to have these conversations, to do things. And, and my appreciation for all of you in attending today is really breaking the stigma and normalizing the conversation that mental health is part of who we are. It's just as important as physical health. And we want to start talking about it in the same ways. So just the way we talk about physical health and we're thinking about our physical safety, mental health is just as important. And we want to start really thinking about how do we reduce the stigma, especially in the workplace as well. Now, one of the things that, again, in my work with the BC First Responder Mental Health Committee, they recognize the importance of reducing stigma. And we created a campaign called the Share It, Don't Wear It campaign. And as you can see with this poster here, we've got representation from fires. You can see on the ends, there's law enforcement and there's dispatch in the middle there. On the left is paramedicine. And across these organizations, we had done a survey looking to first responders about some of the things that they feel that they couldn't talk about when it came to their mental health. And you may be able to see it maybe just very lightly there, but there's words across all of the first responders' faces. And those words are actually, those were words that had come specifically from the survey results. So those are things first responders were saying that they felt they couldn't openly share. So if I read you the one in the middle there, the dispatcher talks about I feel worn down and overwhelmed. Sometimes it's hard to think clearly, and I can't remember when I noticed the change. It just sort of became the normal, I guess. And that was actually words from a dispatcher themselves. So the point of our campaign was to really, with these images and those words, to try to normalize the conversation and to say, it's okay to share it. You don't have to wear it on your heart. You don't have to do this alone. And it's important to speak up and talk about mental health. So that's just a campaign I wanted to share with all of you that we created to help with stigma. Okay, great. So now on to the resources section, and hopefully some information that'll be helpful to you here. So Here to Help is an excellent website. Some of you may be familiar, and there's strategies on here in terms of taking care of your own mental health, as well as if you're looking to support a loved one, a colleague, a peer, a family member. So a number of self-assessment tools, if you're looking to, of course, not diagnose yourself, that would be up to a clinician or a mental health professional, but there are some assessment tools that can help you gauge where you may be when it comes to anxiety, depression, substance use, and other things that may be impacting your mental health. Okay, so Here to Help is a great one. The Canadian Mental Health Association, CMHA-ABC, has some great resources, everything from support for adults as well as youth and children. So another one to check out. We have our Crisis Intervention and Suicide Prevention Center, the Crisis Line, that offers 24-hour support for anyone that may be struggling with thoughts of suicide or self-harm. They also actually have a chat function and texting that's available. That's all confidential and anonymous as well. The Red Book Online is also another great resource I like to make mention of. And the reason is because it's a full catalog of all of the resources that are available in the community through government and social services. So everything from financial assistance to housing to rehabilitation and recovery centers, mental health supports, everything is in that full catalog. And, as we know, financial stress can impact your mental health just as housing and other things can. So really a full list that could potentially be helpful if you're looking for support there. Workplace Strategies for Mental Health is an excellent website, and there's resources under the employees section on how to manage things like burnout, work-life balance, coping with change. So another one that could be helpful if you were interested. Now, free and low-cost counseling, this website here I like to make mention of. It's always updated on a quarterly basis. So the last time it was updated was in April 2023. And it's a full list of services that are available for free or low cost. So in case, let's just say you didn't have access to healthcare benefits, if you didn't have extended benefits or an EFAP program, this list is a list of counselors, psychologists, and service providers that are able to provide support for mental health at free or low cost. And then, of course, I didn't want to forget about and not mention the great supports you have available through your Care for Caregivers website, where you can find your Care to Speak peer support program, as well as a number of other excellent resources, of course, through your website there. And then this last one, actually, that someone made mention to me at the last webinar that I just did a couple weeks ago, I added it to the list, specific to you, Mindwell for Healthcare Workers, an excellent website that has a number of supports, and definitely I would highly recommend to check out when it comes to mental health support. WorkSafeBC also has a number of supports, and I can appreciate, you can't read anything in this guide. So it wasn't intended for you to read any of the material, but I just wanted to make mention that we've got 2 guides on our website at WorkSafeBC.com. The guide for workers is one that may be of interest to you. And this was created during the time of COVID, so managing the mental health effects at work. But I should mention that a lot of the information is still relevant. And outside of COVID, there's still a lot of excellent tools on, again, noticing signs and symptoms if you or someone else is struggling in the workplace, how to talk to a colleague, how to seek support, how to have maybe some conversations around mental health, and then as well as a list of resources that are on both of those guides as well. The guide for employers are more for leadership, but that guide is also available on the website. Okay, and then we've also got our WorkSafeBC resources. So we've got a crisis support line that's available to all of you. And it's for yourself or a family member, anyone, a loved one that may be struggling with an emotional crisis. We've got mental health professionals that are available 24 hours a day at that phone number. And I should make mention that for accessing this support, you do not need a claim. You do not need to submit any type of information. It's private, it's confidential, and it really is just support that's available. So just to make mention that no need for anything in terms of a claim or claims information that's required. We have our critical incident response program, our CIR program that I mentioned earlier. And this is if you have witnessed or been involved in a workplace accident, a near miss, or a fatality. We've got an excellent critical incident response team that are mental health clinicians that are available at that phone number there as well. They offer debriefing and defusing supports. So if there was a critical incident, they can offer one-on-one support as well as group support if you needed that. And then we've got our claims call center, of course, if you've experienced a workplace injury, whether that's physical or mental health, you can call the claims center there. And then we also do lastly have our prevention information line. And this is our information line that provides all sorts of information and resources around occupational health and safety. So this is sort of the line that can offer you supports around things to do with our policy, our legislation, any things around that occupational piece that you may be wanting more information on. Many of the resources that I shared with you earlier are for our BC First Responder Mental Health Committee are found on this website here. So again, as I mentioned, the website was created by first responders, but you may find that there's a lot of relevant and practical tools that may be just as transferable to the work that you do. And I know a lot of different industries use this website at our bcfirstrespondermentalhealth.com. So you can see there's a number of self-assessment tools, there's ways to help, there's a number of resources. So feel free to check that out. On the same website, there's also a whole section on how to support someone as a colleague. So if you're finding in the workplace that you may be noticing someone close to you, a friend or a colleague that's struggling at work, there's a number of excellent supports on how to have a conversation to support colleagues or coworkers. There's a mental health resource list. There's helping troubled coworkers. As you can see, there's a full guide on maybe things of what to say, what not to say, how to navigate those conversations. And then even things like helping people who use substances. So if you're noticing someone struggling there, there's a guide on how to navigate that situation. And lastly, we do have another guide. It's a coworker's guide on supporting someone who's returning from work returning to work from a psychological injury. So this is, understanding mental health and how to support your colleague, maybe some thinking around workload and accommodations. There's a piece around stigma, and then there's also some tips around communication and how to support someone that may be coming back to work, or even maybe someone that's at work that's been struggling with their mental health. Okay, so with that, I know that was a lot of information, but I will open it up to see if there are any questions from anyone.
And I think there was one question posted earlier.
Okay.
It says, how am I going to help a person whom I know suffering from mental health, but does not want to seek help themselves?
Yeah, that's an excellent question. Thank you for bringing that forward. And that can definitely be a challenging one. So I think really as a support person and someone recognizing that, your close one or someone that you care about is struggling, it's really having that open conversation with no judgment, and maybe just noticing and saying, these are the things that I've sort of noticed that I have been happening for you. And, these are the resources that are available. We can't force anyone to seek support. They're going to have to do that themselves. But the best we can do is bring it to their awareness and give them the supports or the referral, the references to be able to connect with those supports when they're ready. So that's what I would say. I can appreciate that it can be a challenging place to be because it's really up to the individual to seek support. But really, I would say is bringing it to their awareness in a gentle, empathetic, compassionate way, and then giving them the information on where they could seek the resources and support that's available.
Thank you. Just being mindful of the time. I know everybody has a busy schedule. So there's one more question that came in the Q&A chat. It says, are you able to do this kind of presentation to teachers or school staff?
Yeah, so feel free to reach out to me. I've got my email there, and we do. So in my role at WorkSafe, this is something that certainly we make available to industries across BC. So whether it's education sector or others, feel free to reach out to me, and I'm happy to put something together in that way.
Perfect. And then the other number one asked question across the board was copy of your presentation or the resource list. And I was just saying that this webinar is recorded. It will be posted on the Care for Caregivers website. If there's any specific questions or specific resources you want to get a hold of, you can email webinars@SafeCareBC, and I can get connected to Amenda, where Amenda has also posted her email. So please feel free to reach out. The webinar recording will be posted on the Care for Caregivers website by this evening or early tomorrow morning. So you're available to access that as well. And just being mindful of the time, I just want to say thank you so much for attending it to everyone, and a big thank you to Amenda. It's been so wonderful to have you. So much great resources and information that is so impactful and helpful. And we thank you so much for taking the time to be here today.
Thank you so much. It's been my pleasure.
Thank you, everyone. So again, the link to this presentation will be on the Care for Caregivers website. And please send myself an email at webinars@safecarebc.ca, or Amanda's contact is on the screen. Thank you and have a wonderful day. Bye-bye.
Thank you.